I just want to mention that you guys are very special, and you're the first to see this work outside of the research team. So that's why I want to ask you questions at the end, because I really want you to pay attention. I just want to mention that this review was done in conjunction with a qualitative review as well. So I'm focusing on the quantitative literature around regulatory mechanisms and their effectiveness, and then Ellen McEachran led a counterpart review that we had a joint search strategy, and I'll talk a little bit about that at the front end, and then it broke off. We did separate studies in terms of synthesizing the quantitative and the qualitative literature. We had an awesome team, so I just want to point that out. 4 economists, incredible. You can never have enough economists. And then we had an amazing statistician, Sheila, and in the mix was a qualitative researcher, Ellen, and then a great systematic review expertise amongst Kim and Emma and Quenby. So I may call on some of you if you're here. Oddly enough, Christina decided to take her vacation this week. I'm not taking it personally, honestly. Okay, so overview and rationale for why we did this systematic review. As you can imagine, for those of you who know this area well, regulation can take very different forms across various jurisdictions and over time as well, so it evolves over time. It's a really a changing world out there. The context is in the labor markets are changing. You know, things such as competitive global markets, contingent employment, limited public resources really make it a challenge to do regulation for occupational health and safety in an efficient and effective way. So doing these literature reviews and actually doing primary analysis studies are really, really critical to help understand what works, when, and why. Cost of regulatory enforcement is quite substantial, as you can imagine. So gathering this evidence I think is really, really critical. And just to give you a sense of what it costs in Ontario, it's about 23% or $220 million of the costs spent on occupational health and safety. By and large, the largest component. And here's a little bit more details about that. So this is 2013 data. Well, we have, sorry, it shouldn't be 23, 43%. So another big component is the health and safety associations as well. And those are the 2 biggest components of health and safety expenditures in the system. So clearly, when we're spending those kinds of resources, we really want to do a good job of that. And the evidence that we're trying to present here today helps inform some of that decision-making, hopefully. So we did a previous review. So this is sort of an update and an expansion as well. So we didn't, we expanded the kinds of scopes of studies that we were including. But we did a review that was published in 2007. And that review looked at the strength of evidence on the effectiveness of 2 key policy levers focused on employer behavioral incentives. One of the ones we looked at then was experience rating. I'm getting hand signals from Ron to speak louder. I'm a very soft-spoken economist, so apologies. So experience rating of insurance premiums, that was part of that first review. And then there was also a component that looked at regulatory mechanisms. So we are updating the regulatory mechanisms component of it in this review. The reviews from the studies we looked at from that previous review started in 1970 and went till 2003. The literature base has grown quite substantially, both on the experience rating side and the regulatory mechanism side, since we did that review. The experience rating review was updated and published in 2012, and I can give you the citation for that for those of you who don't know. So we did do an update on that, but the regulatory mechanism component wasn't updated at that time, so we've done it now. And so this is what we're presenting here today. So findings from that earlier review. So the policy levers that we considered in that review included the introduction of occupational health and safety legislation and regulatory enforcement activities. So we started in 1970 primarily because that's when OSHA came into effect in the U.S. and there was a number of studies that looked at how before and after the introduction of OSHA, what effect that had on health and safety outcomes at the sectoral industry and also at the firm level. So that was the reason why we started with that date for our study search. We'd also looked at particular enforcement activities such as citations, inspections, citations, and penalties, and looking at to see how effective those kinds of policy levers were. Now, the key findings from that review on the regulatory enforcement side was that we found mixed evidence that the introduction of regulation reduces injuries. We found limited to mixed evidence that general and specific deterrence of inspections and general deterrence of citations has an impact on injuries. So I'm not sure if you understand that vocabulary of general and specific deterrence. Are you all familiar with that vocabulary? You good? No, you're not. Okay. Well, the next slide actually has some definitions, so I'll get into it. But general deterrence essentially is about knowing that there's the probability of being inspected, cited, and fined for noncompliance. That will be sufficient to encourage an organization, a firm, to be compliant. Whereas specific deterrence is the actual impact it has on an organization's behavior when they actually get cited and fined. So the general one is just that knowing it might happen is an incentive to be compliant. The other one is more focused on when it actually happens, how do behaviors change. We actually found strong evidence that actual citations and penalties reduce injuries. So the message that came from that review was that the general deterrence wasn't sufficient. You really had to be out there citing and fining firms for noncompliance in order to have a real impact on behaviors and encouraging health and safety investments and being compliant with legislation. So here's a little bit more details about general and specific deterrence for those of you who don't know it. General deterrence is the probability. So it's just knowing the probability. You know, it's sort of like any kind of enforcement vehicle. Not everybody can be inspected. Certain random sampling or however the decision is made by the inspector to visit some work sites. They can't see them all in any particular year. But other workplaces may also react to the fact that they may be inspected. So that probability of inspection has a deterrent effect. And specific deterrence is the actual impact that having an inspection and being cited and fined has on behaviors at the organizational level. So as you can imagine, the complexity of regulatory enforcement is sometimes overwhelming. Multiple reasons why regulations and enforcement may be ineffective. And these are some of the things we want to think about when we look at this literature and also when we're doing studies to try to understand how we can tweak out the impacts of specific policy levers and changes in those policy levers. So in some cases, regulation may not address the root causes of injuries. So if you're not getting the legislation right, it won't have an impact. The regulator's ability to detect noncompliance may not be sufficient. So are they able to find out that a firm isn't compliant by a particular visit for a period of whatever, 1 or 2 hours? Is that sufficient time to identify noncompliance in the multiple areas that may be relevant? The regulator may not be able to restrict ability to enforce compliance or punish noncompliance. So even if they do detect it, are they able to oblige firms to be compliant? Are they able to punish noncompliance? Is there the capacity in the system to do that? The threat of punishment may not be an effective deterrent. So that's the general deterrence thing that I emphasized earlier on. Knowing that you might be inspected and fined, even if you're not, would you still be compliant as an organization? And there are reasons to think of why that might not be the case. Are they aware of the legislation? Do they know how to be compliant? Do they have the resources to be able to be compliant? Do they take risks, such as thinking that, the probability of being inspected is 1%, so why bother investing all those resources this year? That kind of thing. So there are all kinds of reasons why the threat of an inspection may not be sufficient. Firms may not always act rationally. Economists like to think that everybody is rational and they think long term, they maximize over the long run. But firms are often really just trying to survive, putting out fires when they see them, kind of thing, thinking short-sightedly about how do we get through the next week, the next month, the next year. So a number of reasons why they may not be thinking optimally, and that could be a reason why the threat of a punishment may not be sufficient, because the threat would only be sufficient if they could think about the long run. Punishment may create also antagonism. So is it creating the right kind of behavioral responses? Do they end up trying to circumvent the regulator? There's also this notion in economics about regulatory capture, where you try to befriend the regulator so that they're less likely to be difficult with you. A number of different behavioral responses that may not be the ones that you really want to encourage, right? So maybe, that certain tactics may not be the best ones to approach regulatory enforcement with, such as, antagonism. Punishment may also divert attention away from important health and safety issues. So the efforts are being directed towards compliance rather than the ultimate injury and illness outcomes. So like the Rubik's Cube, it's a complex mix of what you want to think about in terms of that package of regulatory enforcement and policy levers that are optimal. So what mix is ideal? So it can take many forms, as I've mentioned. It could be education, assistance, persuasion, promotion, some financial incentives, monitoring, enforcement, and sanctions. Each of these activities are actually done in the field in various jurisdictions and contribute in various ways to the achievement of that mission of ensuring healthy and safe workplaces. But identifying that optimal mix is a real challenge. It's a tangled web of different kinds of effects and contexts that can make a big difference. And linking specific actions, taking just one of those items and identifying its individual impact at the margins can be quite difficult. On the research side, then, how to parse out that marginal effect is also a challenge. And that's what this literature tries to do. Understand a particular policy lever and how at the margins it has an impact or doesn't on health and safety outcomes or compliance. You have to have a good conceptual understanding of the behavior of stakeholders. You obviously need very good data to be able to do that as well on the quantitative side. Appropriate study design, and they can take different forms. You might use statistical methodology to control for context. There might be a natural experiment where new legislation is brought into effect and you want to see before and after that introduction of legislation. You might sometimes, but probably very rarely, have randomized controlled trials. In the real world, that's a challenge to do in workplaces, but sometimes that might happen. You also need sufficient measurement time to be able to detect an effect. How long does it take to see a final outcome change as a result of the introduction of new legislation? And do you have the luxury of being in the field collecting data or have good data that reflects that whole time period to be able to identify that effect? And then finally, you have to really have a deep understanding of what the results of your analysis means for the real-world phenomenon. And I really focus on that because oftentimes you see a huge leap of faith in discussions of studies that go far beyond their statistical analyses and make policy prescriptions that aren't necessarily grounded in their analyses, sort of thing. And all of these things are the things that we as reviewers were thinking about when we evaluated this literature. So it kind of sometimes looks like that, or you feel that way, where deconstructing and then reconstructing that complexity can really be a challenge. So getting into our review then. So our overarching question for this review is, what is the strength of evidence on the effectiveness of occupational health and safety policy levers in creating those incentives for organizations to focus on health and safety issues? And as I mentioned, we expanded our scope from our previous review. So in this one, we are looking at intermediate outcomes as well as final outcomes. By intermediate outcomes, I'm referring to compliance. The ultimate outcome is, safe and healthy and safe workplace. So injury and illness outcomes are the final outcomes, but intermediate outcomes are compliance is a critical thing to think about as well. We also included smoke-free workplace legislation in the mix here, and maybe you'll appreciate it more when I get into the results of our findings and how we might be able to learn from some of this literature as well to understand what's in the mix that makes it work well or doesn't work well. We also included awareness campaigns and the nature of enforcement. So these are all additions to the kinds of things we were looking at in our previous review. So the methods. And I'm not going to focus too much on the methods because you probably have seen a lot of systematic reviews being presented here, but I'll give a little bit of time to this. We had an international advisory committee giving us some guidance at strategic points, particularly at the front end and towards the tail end where we were getting some preliminary findings from our review. So they really give us some advice on context and interpretation of our findings. Search strategy, as I mentioned, we combined the quantitative and qualitative reviews at the front end of our review process so that search strategy was common to both. And then the quality assessment and evidence synthesis was where we parted ways in some respects and did separate reviews for the qualitative and quantitative one. For our quantitative one, we drew on the methods and tools we used in our previous literature review. So since we had that precedence, we followed with that. We took a best evidence synthesis approach, and are you all familiar with that vocabulary? So, yes? So it looks at the quality of the studies that we find, the quantity and consistency of the studies to make a synthesis statement based on the evidence on how many studies, how good they are, and how consistent they are in their findings. So our search strategy. So we had 4 categories, which is sort of a modified PICO. And actually, PICO is a superhero. Where's Quenby? Quenby did our search for us, so she's the superhero for us. We looked at regulatory focus, a setting, policy levers, and then looking at the context, so the conditions and outcomes that were really critical. Our first level screening, the studies had to consider the directives that were related to occupational health and safety legislation or regulation, and that they were made by a government authority. So policies within a workplace we didn't consider, and it had to be regulatory mechanisms at the governmental level. Studies had to evaluate occupational health and safety legislation or regulation using both quantitative and qualitative methods. And at that front end, we were putting them into one of those baskets, or sometimes we put them into a mixed methods basket. So screening for the quantitative review. So at the next stage, then, we had some more honing to do to tweak out the ones that were appropriate for our quantitative review. So the incremental things we looked for were that the study had some temporal element to it. What I mean by that is the study was, looking at outcomes, context and outcomes over a period of time so that we could better understand the sequencing of events. When legislation comes into effect, what happens after that, that kind of thing. So that a cross-sectional study it's hard to understand cause and effect in cross-sectional data. So we really wanted a temporal sequencing in the data. And it could be done in different ways. It could be panel data on organizations, or they could ask respondents about past experiences as well as current experiences. So all of that still constitutes some sense of temporality in the data. The study design had to be rigorous, so it had to use multiple regressions, what's very common in this literature because it's being done by economists, so they're using statistical methods to control for context. Or it could be a quasi-experimental design. And some of the studies, particularly the ones were about smoke-free workplace legislation, often had a quasi-experimental design. So we allowed either types of methods in our review. The study had to consider final outcomes, such as injuries and illnesses, or the intermediate outcomes of compliance. I won't get into details here, but we had a quality assessment tool that had 2 parts. We were assessing the overall quality of the study, and then we were honing down on the policy lever that was of interest to us, whether it was about enforcement measures or citations and penalties. So we drilled down to say, did that policy lever get measured in a meaningful way and reflected meaningful context? And the way we ranked studies was it had to be the lowest of the 2 categories. They were kind of clustered together separately. So if you did poorly on this, the overall study was poor. If you did poorly on this, the overall study was poor. And down below, I'm not sure if you can see that, we had ratings of low, medium, and high quality. And we only kept medium and high quality studies in the mix. So high quality had to be 70% or higher in the assessment of both of those categories, and medium 50 to 70% in the assessment of those 2 categories. looks kind of scary, but I'll try to go through it. So this is our best evidence synthesis approach. So we have like 5 categories. Strong evidence requires a minimum of 3 high-quality studies, and they have to obviously be consistent in their findings. Moderate, limited, and mixed evidence, medium quality is sufficient, and different numbers of studies that are consistent in their findings. For moderate evidence, 2 high-quality studies or 2 medium-quality studies and a high-quality study that agree. And then we get into limited and mixed evidence. So the way it worked was you cascaded down the hierarchy. Did it meet this criterion? If it didn't, did it meet this criterion? If it didn't, did it meet that criterion? For each cluster that we were trying to synthesize. In terms of our search results, we had a total of quite a few studies. So PICO, served us well, but still gave us a lot of work. 12,000 titles and abstracts. Number of different databases that we looked at, and I won't get into any of these details here, but we were trying to be comprehensive of the various places we might see this kind of literature, and you can see how many hits we get with each of those sources. In terms of the flow of our titles and abstracts and quality assessment of studies, we started off with the 12,000. Titles and abstracts screening left us with just over 2,000. Then we broke it up into the qualitative and quantitative side. For the quantitative rigor screening, we were left with 61 studies, and 3 more came up through the references of those studies. And then finally, when we went through the quality assessment, in terms of medium and high quality studies, we ended up with 43 studies. And then 21 low quality studies, which didn't serve us in terms of the synthesis statements. In this graph, this chart, I'm just trying to show a comparison with our previous review, just to get a sense of how it differs and the overlap between them. So the time period, as I mentioned, was 1970 to 2003 with the earlier review. This one we started in 1990, went up to 2013. In the first review, we did include gray literature, which we didn't do in this case. We only looked at the peer-reviewed literature. The types of outcomes, the first review we looked at only final outcomes, injuries and illness outcomes. In this review, we also looked at the intermediate outcomes. In terms of the clusters, that in the subsequent slides, I'm going to give some synthesis statements across each of these clusters. We looked at the introduction of legislation in both reviews, but I note that in the first review, the introduction of legislation was really about broad brush legislation such as OSHA in the US and similar counterparts in provinces in Canada. Whereas the studies we're looking at now, particularly because the time period we're looking at is 1990 onward, were the introduction of particular legislation that's incremental to the larger foundations of occupational health and safety. So, the introduction of smoke-free legislation, or the introduction of some kind of specific regulatory policy that a certain industry needs to follow. So it's a really different type of studies that we're looking at in the introduction of legislation in this review. The introduction of smoke-free workplace legislation wasn't part of our earlier review. We also now looked at inspection sequence, general and specific deterrence was in both reviews. And then in this review, we're also looking at the nature of enforcement and awareness campaigns. So in the subsequent slides, I'm going to go through the synthesis statements for each of these clusters. So noteworthy is that improvement in quality of the studies. We actually really were cognizant of the fact that the quality did improve. So evidence synthesis. So I'm just going to start off now with my synthesis statements. Starting off with the introduction of occupational health and safety legislation. And I pointed out earlier, and I want to reemphasize, it was a mix of different legislations that were being introduced in this cluster. So you might question, well, does it all fit together to make a general synthesis statement of it? Some of them were hearing loss conservation, chemical exposure mitigation. These are some sector-specific at times. Universal precautions for bloodborne pathogens, obviously, in the healthcare sector. Ergonomic regulations, log-out, tag-out requirements, more than that, too. So this was a mixed bag of different legislations being introduced. Some considered final outcomes of injuries, illnesses, and fatalities. Others considered intermediate outcomes. And we made synthesis statements separately for intermediate outcomes versus final outcomes. So what we found was that there was moderate evidence that the introduction of legislation has no effect on injury outcomes. So don't despair, because we'll talk a bit more about it and try to think about why that might have been the case. There was limited evidence that the introduction of legislation improved in the intermediate outcomes of compliance, particularly. So that's some hope. Okay. Now, this is a special case of the introduction of smoke-free workplace legislation. It just so happens that a lot of jurisdictions in Europe and North America and other places as well, during the time periods we're looking at, particularly from 2000 onward, were introducing smoke-free workplace legislation, particularly in the service, food service sector, in bars and restaurants and gambling facilities and things like that. So there was a lot of studies we came across in this cluster, well, 6 that we kept in our synthesis statement. So there were different types of legislations in different jurisdictions. There were either North American jurisdictions or European ones. Some considered final outcomes. They actually were on site identifying respiratory and sensory symptoms before and after the introduction of the legislation. Others considered intermediate outcomes such as reduction in smoking exposures and reduction in cigarette consumption. So what we found was there was strong evidence that the introduction of smoke-free legislation reduces exposures to smoke, and moderate evidence that the introduction of this legislation reduces respiratory and sensory symptoms, so the final outcomes kind of thing. So it's quite different from that previous synthesis statement that I was making, where there was quite good evidence that there was a substantial impact, and I'll want to discuss later, maybe when we have time at the end, why there's a difference between these two different kind of clusters of introduction of legislation. So inspection sequence, 4 studies that were in this cluster. Oh, by the way, the two high, that's the H is high, and 2 medium are in that cluster. All these studies were undertaken in the U.S. or using U.S. jurisdictional data. They considered how inspection sequence influences compliance rates based on changes in the compliance from one inspection to the next. So what this literature had to say was there was moderate evidence that that first inspection had a substantial impact on compliance, but then subsequent inspections to that same work site had very marginal impacts. So that first inspection had a big impact, and then it petered out very, very quickly. So it gives some insights into resource use. Is it worth inspecting 2, 3, 4 times in a particular time period? Possibly not. Evidence synthesis for the general deterrence of inspections and penalties. There was 3 studies in this cluster. These studies considered the aggregate probability of being inspected using industry-level data. So what was the probability of any particular firm would be inspected based on the frequency of inspections in a particular sector. The final outcomes that they looked at were lost time injury rates, lost work days, and fatality rates. So what we found was limited evidence that the general deterrence effect had no effect on lost time injuries, and limited evidence that general deterrence reduces fatalities and lost work days. So in some cases it didn't seem to have an impact, in others it did, but very limited evidence. Obviously 3 studies that are medium quality, we really can't make any strong statements with only 3 medium quality studies, so just limited evidence. For specific deterrence of inspections with penalties, we had quite a number of studies in this cluster. It was the biggest cluster, 13 studies. Most considered specific deterrence in the form of inspections with and without penalties. So they were looking at a firm that was inspected. Did it have a citation or penalty? Yes, no, kind of thing. And did it have an impact if it did have if the firm did have a citation or penalty, or did it have an impact when they didn't have a citation or penalty? Some considered enforcement activities such as consultations or other details of the inspection activity as well. So some of them got really into the details of that inspection activity. Strong evidence that inspections with penalties reduce injuries. Very consistent with what we found in our previous review. Moderate evidence that inspections without penalties have no effect on injury. So being on site, doing an inspection and having no citation seems to have no effect on the behavior of that particular firm. And then limited evidence that compliance reviews of, this is particularly in the motor safety performance, reduces truck crashes. This was a very specialized one-off study, and we kept it in the mix. And they found it was quite a good quality study. It's rated as high quality and found significant effects. Now, the nature of enforcement. We found 6 studies that we retained in this cluster. We divided this into 2 groups. Consultative activities, we had 4 studies there, and then state versus federal OSHA enforcement. And this is particularly pertinent maybe to the U.S., where there's an option where some states choose to do their own enforcement of regulation, and some rely on the federal OSHA body to do that enforcement. So we found 2 studies there. So strong to limited evidence that consultations have no effect on injuries. And the reason we have this kind of dual kind of finding is one of the studies looked at fixed site and non-fixed site locations. I think it was in the construction industry, if I'm not mistaken. And it only worked in the non-fixed site locations. So they found no effect on the fixed site and some effects in the non-fixed site. They were all high-quality studies, but by and large, the bulk of that literature seemed to suggest no effect. So I'm leaning towards that strong evidence that it really didn't have a big impact. Limited evidence that autonomy supportive styles reduce the number of visits to achieve compliance. So this is looking at specific styles of enforcement. Autonomy supportive meaning you're more consultative, working with the workplace to help them get compliant. And there's just limited evidence. We only had 1 high-quality study there. And then limited evidence that state enforcement results in lower fatality rates compared to federal level enforcement. And the issue there with state versus federal, there's some discussion in those 2 studies about do local inspectors have a better sense of those industries and what's happening in the field? Are they more familiar with the turf than somebody coming from the federal level jurisdiction, and trying to understand whether that has an impact on compliance and ultimately on injury outcomes. And then the last cluster we have is on awareness campaigns. So 4 studies were retained in this cluster. These studies were in different sectors, and they focused on different kinds of OHS risks, like noise regulation, guidelines related to child labor in agriculture, eye injury campaigns, managerial training programs. 2 of the studies considered final outcomes and 2 considered intermediate outcomes. So we found limited evidence that campaigns reduce injuries, and moderate evidence that campaigns improve compliance. So not a big cluster, but interesting to think about whether just awareness has an impact. So now I'm moving on to my questions for you guys. So the introduction of legislation. We had 2 clusters, if you recall. One was a broad brush mix of different kinds of legislations that were introduced, and another one was about smoke-free workplace legislation, and very different findings. And I'm just wondering, what can we learn from that smoke-free workplace legislation that's somehow different? Is it about awareness? Is it about the obviousness of, when you come into a workplace, that somebody's been smoking? Is it about broad brush public awareness and vigilance? Is, social norms and expectations and that make a difference? There might be something to be learned from that smoke-free workplace literature that we could think about. How can we create the same kinds of context in other regulatory environments? Specific deterrence. Our findings reinforce what we found in our earlier review, that being in the field, citing and finding non-compliance is really, really critical. Consultations appear to have no effect on injury outcomes. So what are the implications for that in the move toward more voluntary guidelines, as is happening in many jurisdictions? We didn't see any studies that were focused exclusively or focused on voluntary guidelines and their impact, but I thought that the consultations might give us some insights into whether that kind of an environment of voluntary guidelines might be effective. In terms of compliance outcomes, the first inspection has the largest impact, and should we put more resources into multiple inspections, or should we focus on spreading out those resources across a lot of organizations in a particular sector. Awareness campaigns improve compliance to some degree. And then what is the relationship, then I ask, between compliance and injury outcomes? You know, there wasn't a whole lot of studies really focusing on the two concurrently. In fact, none of the studies actually looked at, does compliance mean that you're a safer workplace in terms of final outcomes? And then I think there's a need to do more of these kinds of studies, and creating the opportunity to do them is really, really critical. And I encourage anybody who's in the policy arena to promote researchers coming into the field with you guys to learn more about what works, when, and why.
Join me in thanking Emile for a very engaging.
Thank you.